have this information, let's use it to prolong my life in a way that I would never got the chance to do before.
Information that could change her future. How you can use cardiovascular genetic counseling to plan ahead and help manage your health right now. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. A first of its kind in our region, cardiovascular genetic counseling. Addison Correll has lived with a heart condition her entire life. Now she finally understands how she got it. Addison Correll vividly remembers the time as a child when she first realized she was different.
And I was like, oh, these kids are running around like it's nothing, and here I am struggling to keep up.
Her diagnosis, though, had come years earlier as a newborn baby. Mitral valve prolapse, when an abnormal valve causes blood to flow backward through the mitral valve with every heartbeat. Over the years, it can weaken the heart muscle, developing into congestive heart failure. For years, Addison was able to manage it with medications. But in her late teens, things got unbearable.
I can't even go upstairs. I can't walk. I literally felt like I couldn't do anything. It just felt like my heart was beating outside of my chest. Like you could see like my shirt, it was like moving.
At age 20, she had open heart surgery to repair her mitral valve. 6 years later, she has regular echocardiograms and checkups, and now Addison has something else she never dreamed she'd get, an answer.
I was like, oh my goodness, there's a name to what has been happening.
Shortly after transitioning into the adult congenital heart disease clinic here at the University of Kansas Health System, her cardiologist suggested she get cardiac genetic testing.
So the testing that I offered Addison, called exome sequencing, looked at thousands of her genes related to her symptoms.
And genetic counselor Farah Amori says in one of those thousands of genes, they discovered a single misspelling. They don't call them mutations anymore.
Think of this gene as a very long sentence with a lot of letters inside. What they do is they check every letter to see if there are any changes in the spelling of this gene, and that causes the gene not to work the way that it should.
Further testing revealed Addison inherited that misspelling from someone in her family.
It's more solving this diagnostic odyssey that she has lived with for over 26 years.
For Addison, her answers came all at once. Her health journey also inspired her to change jobs. She's now an administrative assistant here at the health system, working in cardiac rehab, an area she knows well.
I love it. I mean, I see patients who've gone through something that I also went through. If I see somebody, having a hard time, I'm like, hey, I've been there. Here I am to show you that I went through it. You can also do it as well. It's hard, but it's worth it in the end.
We have such a good panel today. We have Addison Correll right here with us, and joining us as well as her cardiologist, Dr. J.D. Serfas, and we have Shobana Kubendran. Shobana is a genetic counselor, and she's manager of the whole genetic counseling services clinic here at the health system. I am so glad that you were able to make time to join us. Thank you. Addison, how are you feeling?
That replay was a little emotional.
Got you?
I was like, whoa, some of those videos were a little touching.
Yeah.
But it's good. It's a good feeling, so.
Does it bring you back to the beginning of your journey, all that wondering over the years?
Yeah, and then just realizing that you actually made it through is kind of a little touching.
Yeah, it's something
Try to keep it together, but yeah,
it's okay.
It's good.
You're allowed to be emotional about this. And Addison, you didn't just make it through, you're thriving.
Yeah.
You've been a heart patient since you were a day old. After all these years, you finally have answers. What did that do for you emotionally and mentally to have answers?
It was still a long journey, still processing through all those things, but to have answers to kind of explain why I've had all these things my whole life is just, it's kind of calming to understand that there's reasoning behind it. But still there's appointments happening and things happening that just kind of get understanding for hopefully to prolong my life with having this diagnosis. So
And yes, it doesn't change that you have it.
Right.
But you did learn that the genesis of your cardiac problems is genetic.
Yep.
Do you know if anyone else in your family has gotten this kind of testing?
Yeah. So when I got the genetic counseling done, my mom and my dad both got tested, and it came back with my mom having the same genetic marker that I did. So.
Thanks, Mom.
Yeah. Thanks.
We always get things from our parents that are great and things that you just can't control.
Yep.
Dr. Serfas, you're the one that encouraged Addison to get genetic counseling. Why did you feel the push to tell her, get this?
Sure. So, we've learned to recognize certain patterns. For one thing, the type of mitral valve prolapse that Addison has is a variation that's more commonly associated with underlying genetic disorders. But Addison also shared with me that you were born with some hearing loss and you've had to have surgery on your jaw in the past. And that combination of head and neck problems that we're born with and heart problems is very commonly associated with underlying genetic disorders. And so I felt it was definitely worth a look to see if there was something under the hood.
Did you find out, was the hearing loss and the jaw surgery you needed connected to the heart, or is that just another layer of the onion that you have to deal with?
I think it's just another layer of the onion that you have to deal with.
Another surprise thing that
But I think it all kind of connected with the genetic disorder that was underlying, and so it kind of just brought those to the surface. Was like, oh, these are part of that. So.
And we have some illustrations that can help people understand Addison's heart problem. Dr. Serfas, can you explain what we're looking at here in relation to Addison's heart?
Sure. So on the left you see a picture of a normal mitral valve. And a mitral valve has to close and really anchor down low. You can see those two leaflets of the mitral valve sitting down low, and that prevents leakage of the blood backwards. What Addison has is a particular form of mitral valve prolapse where you just have too much leaflet tissue. We call it redundant. And so these leaflets get really floppy and big. And so they meet, sure, but then instead of anchoring down low, they kind of rise up high like you're seeing there in the middle picture. And if it gets bad enough, you'll actually see some of them come up high enough that blood starts leaking backwards and going up in the wrong direction.
And so Addison underwent surgery at the age of 20 to repair that valve, and then recently switched her care to you at the Adult Congenital Heart Disease Clinic here at the health system. How often does Addison need to see you now?
Sure. So that's such a good point. We see a lot of patients like Addison who had heart surgery as a child or as a young adult. And the truth is that for all of us who've had heart surgery, their problem has been treated but not fixed. And so regular follow-up is still necessary, and we will get echoes every so often. So obviously I'm happy to see Addison anytime she has a cardiac concern or question, but at a minimum we'll see her once a year.
Do you guys see each other in the hallways?
Not until today.
Yeah.
And can you high-five her when you see her? Or is there a HIPAA violation? Do you have to say, hi, colleague? There you go. Addison, does knowing this medical condition is caused by a genetic misspelling, does that change your treatment plan? We touched on this a little bit.
I say yes. Yes and no. I mean, I'm going to keep doing what I've been doing, but I think it's just understanding that it's there, and hopefully, I mean, me and Dr. Serfas can work together, and hopefully if there's something that's in the future that I can kind of prevent from happening, then I will. But as of right now, I'm just going to keep going about what I'm doing.
And, which is a great plan, because you're doing everything right. I want to bring Shobana into this, and Shobana, I'm going to slide this piece of paper down so you can see what the audience is seeing. Shobana, the health system is home to the region's first dedicated cardiovascular genetic counseling service. Out of the thousands of genes we all have, we have thousands of genes.
20,000.
20,000 genes.
Give or take.
What markers do you look for in cardiac testing?
Yeah, absolutely. So when we talk about markers, we're looking at different types of genetic variation in the code. So as Farah explained in the video, it's like a long sequence of letters. And think of it like recipes in a book, in a cookbook. And we're trying to see, Are there any spelling mistakes? So instead of 2 teaspoons of baking soda, if it's 10 teaspoons of baking soda, you know that even without making that recipe, you know it's going to change.
A big typo.
That's a big change. Yeah.
Right.
Yeah. You just read the recipe and you're like, nope,
That's wrong.
this cookie is wrong. But what if you find a variation that's like instead of 2 teaspoons, you find 2.5 teaspoons? You're like, intuitively, you kind of know, but maybe it doesn't. So those are what we call variations of uncertain significance.
We have a great example that Shobana shared with us. I want to put this up on the screen.
Yeah.
We call this the cat in the hat
Yep.
explanation. What it looks like when you see those misspellings.
Yeah.
When you look at this list and you see different letters or words transposed or misspelled, which row is Addison?
I would go down to the very last one, the cat in the zet. So instead of where it's supposed to say the cat in the hat, she has a variation of it that causes what we in technical terms call frame shift mutation. So it changes how the rest of the genetic code is expressed. So there's a spelling mistake that prevents the rest of the gene from making the protein. So each gene makes a protein, and if you have a spelling mistake, that protein does not get made correctly.
So one spelling mistake can change the meaning of the whole sentence.
Yes.
I just love how your colleague Farah explained it, that it's a misspelling.
Yeah.
You learn something new every day on these programs. And one thing I think we all learned is you don't say mutation, it's a misspelling.
Yeah.
Which is way more clear, and it's, the word mutation isn't a great word to use.
Yeah,
for
no, there
anything.
is
It's
no
not
such
accurate.
thing as a normal genetic code. I can tell you that. It's all variations
Oh, that's interesting. So
Yeah.
everybody has their own genes, so they're all spelled differently.
Yep.
So I want to get to this, and then we're going to get to community questions. When someone decides they want genetic testing, what are the steps they take? Someone watching here might say, hey, I want to get this.
Yeah, definitely. If you want to get genetic testing, speak to your primary care provider, speak to your cardiologist. Some of the basic questions of like, hey, is this genetic? They can help answer. And then based on the type of indication, they will refer, like Dr. Serfas said, hey, there's 2 things going on here. It's not just cardiac. You have other health concerns. So definitely get a referral to genetic counseling. And the process for a genetic counseling appointment, what we do is we go through a 3-generation family history. If we have it, that's great. If not, don't worry. We go through the rest of the medical history. And then working with your primary care physician, we build what's called, what is the differential diagnosis? So that's where genetic counselors work as a team with primary care physicians and the specialists, because we take the clinical information that your providers have given and then your medical and family history, and we put that together to say, is there a pattern and what genetic test could help? There are many different types of genetic tests. So for those listening in, what the genetic counselor's expertise is helping you determine which genetic testing strategy would be the most cost effective and would be the most informative. So like Farah offered you 2 tests. If you go back to the examples, she offered you 1 test that looks to see within the 20,000 genes, is anything missing or extra. And that's called a microarray. We start with that because it gives us an answer about 10 to 20% of the time. If that test is negative, we go to exome sequencing, where we look, and that's the test. So microarray looks to see if anything is missing or extra in the recipe, and exome sequencing looks at the spelling mistakes. Now, you can do it either way. You can do exome first and then microarray, but it all depends on working with Dr. Serfas, what the differential diagnosis is, so we determine what would be the right approach. The other thing to listen in for everybody else, I'm sure Farah, when she talked to you, she told you about the benefits and limitations of testing, like what this can do and cannot answer, and importantly, what this means for your family.
We have some great questions coming in. My phone is buzzing as I look at the Facebook questions coming in. If you have a question, send it to us on YouTube. You can do Facebook or the All Things Heart email. You will find all the links on how you can connect with us in real time and get your questions answered right there on your screen. So we're going to get to those in a minute. We also know that many women undergo genetic counseling when they're pregnant or before they get pregnant. So how does cardiology genetic testing differ from other types of genetic testing options when it comes to planning a family?
Sure. With cardiology genetic testing, we're testing, like for example, Addison, we did genetic testing on you first. So we're testing the affected individual first, and first finding out, is there a genetic marker that explains why you have cardiomyopathy, arrhythmia, congenital heart defect. So we start with a cardiac focus, and then if we find that genetic marker, then we say, for example, in Addison's case, we were like, oh, this explains why you have the hearing loss. And then we look through the rest of the family, and then we pull in, what is the range in expression? What are the other features that can be seen? And that's the next stage with Addison's journey, is going through explaining, here are the range of features. It's like any genetic condition is like a buffet table, right? So yeah, my daughter watching this is probably like another cooking analogy.
But it makes sense.
It does, right? It's like a buffet table.
Yeah.
So one individual, so you have two buffet tables, one from your mom's side, one's from your dad's side of the family, right? And you go through the buffet table and you're like, you know, there's turkey, there's mashed potatoes. I'm just going to take the mashed potatoes and I'm going to take another side dish, but I'm not going to take the main feature, because the main feature, that's the one that's most prominent. Like other individuals with that genetic condition can have developmental delays.
Yeah.
So that's where we are now in any genetic condition. What is the range of expression? Severe, moderate, mild? And where are you in that spectrum? And what does that mean if you were to pass this on?
Okay. So you can start thinking about that, which lucky you, you're so young, and then knowing genetics, do you feel like it forces you to plan for the future in a way you didn't really want to right now?
Yes, 100%. I'm like, I am 26 years old. I would never think that I would have to be thinking about these things right now, but I mean, I'm taking it day
It'll
by
come
day,
in
but
handy.
Yeah.
If you do decide to
Yes,
go down that
for
road.
sure.
Dr. Serfas, do you recommend genetic counseling to all your congenital heart patients, or just the ones where you see those other symptoms like Addison had with the hearing loss or a jaw surgery?
Yeah, that's a great question. You know, so I specialize in congenital heart disease, which means heart disease that you're born with. And you'd think that, oh, we'd have a genetic explanation for all of that. But the reality is that the majority of the congenital heart disease that we see is what we call sporadic, meaning that it's not necessarily associated with a known underlying genetic cause. And so it's actually a relative minority of my patients that I recommend get genetic testing. And it's when I see those patterns, those certain cardiac defects that are known to be associated with certain genetic disorders, or combinations of defects like the heart and the head and neck that we talked about.
So when we learned that that Addison carries this gene, it's a dominant gene, does that mean she's guaranteed to pass it on to a child if she has a child, or just it's likely she will?
Yeah, so we have two copies of the gene, and this gene is expressed in what we call dominant manner, meaning if you have one copy of the gene with the mutation, you can express the condition. So Addison has two copies of the gene. It's a flip of the coin what you pass on, similar like your mom.
Yeah.
You know, and I wonder how she felt when she heard like she flipped, you know, heads for you. So it's a 50-50 chance to pass it on. But going back, how it expresses itself is that buffet table. Are you going to pick everything on the menu that is associated with that genetic condition, or are you just going to pick and choose the few? And that's the piece in genetic counseling that we try to help families and individuals understand, is that variable expression, because we've given you not a diagnosis. We want to help you and your family understand how to adapt to this information. How do you adapt to that risk? And that's a journey, that's a lifelong journey, and Farah and I are going to be here for you for the rest of that.
And that's so great to know you've got this team behind you. If a woman who has this genetic spelling gets pregnant, is there a test that you can do to see if her fetus would carry this gene, this heart gene? Should I ask Dr. Serfas or Shobana? Who wants
There are
to take
two
this one?
ways. So
Okay.
if they come to Dr. Serfas, I'm not going to answer for him. So you can make a diagnosis clinically and with genetic testing.
Okay.
So I'll answer the genetic component and then tag it on to you.
Okay.
And both answers are just as valid. If they came to a genetic counselor, we would say, here are your options for determining whether you've passed it on. You can start anywhere from in vitro fertilization. Those are options. So we have 4 prenatal genetic counselors in the health system who can help navigate you through all the prenatal testing options. And then during pregnancy, you can have a procedure called amniocentesis, where you take the fluid, the needle never touches the baby, but you take fluid that surrounds the baby and you can test to see if there's a genetic mutation.
Cardiac genetic
yeah,
misspelling.
if you know what is running in the family.
Got
So
it.
only because you can clinically diagnose it as well, and that's where the ultrasound comes in. So we walk through the family, and this is again a teamwork approach with the cardiologist and having the Addison, you get to make that choice. These are what we call informed decision making. We have genetic options for diagnosis, and then I'll tee it over to you for the non-genetic
Sure.
ways.
Yeah, so for any patient with congenital heart disease, male or female, if they or their spouse are expecting, I recommend that they get what we call a fetal echo, which is basically just an ultrasound of the fetus's heart that's really dedicated to look for and screen for heart defects. And that's very useful because you can identify most congenital heart disease that way, not all, but especially the severe ones where it's very helpful to know before birth so that the neonatology team can plan for how they're going to deal with that.
Yeah.
The nice thing about the clinical testing is it works whether you have a known genetic code or not.
Yeah.
And so we do that for everyone, whether we have done genetic testing or not. But the amniocentesis gets a real genetic diagnosis and would be especially useful in a situation where you do have a known genetic misspelling that can be looked for specifically in the fetus.
Addison, we talked to you about the added stress of having to plan far ahead when you're not there yet. Have you ever looked back throughout your memories of family and remembered, oh, there was Aunt Marge who had a hearing problem, or you knew someone who needed jaw surgery? Did you ever see anyone in your family that presented like this?
No, the only person would be my mom. She grew up with hearing aids as well. And so I always just thought, she had hearing aids, that means that I had hearing aids. I got
Right.
that gene or whatever, and then, getting the
Now you
diagnosis
know.
and realizing my mom also has it, kind of just put the dots together, but nobody else on her side of the family
Right.
had anything else like that, so
Now you hold the key.
yeah.
You hold the key.
I do.
We have some great questions coming in, and I want to get to them. I'm going to put on my glasses. I inherited needing glasses from both parents. Yen Liang wants to know, he writes, from what I know, mitral valve prolapse is quite common in women after menopause, and doctors usually don't recommend any specific treatment. But why, despite having the same conditions as our guest today, have to endure such unusual discomfort? It's an interesting question from Yen.
That's a fantastic question. I'll take this one. So mitral valve prolapse comes in a lot of forms, and they're not all the same. Mitral valve prolapse is actually quite common, and for the large majority of people, especially what we see in women after menopause, it's a very different abnormality in the mitral valve than what Addison had. And that can still sometimes cause problems, but most of the time it doesn't. And it's only once that prolapse gets to the point of causing a lot of leak of that mitral valve that we really need to do anything about it other than watch it.
Stu has a great question. Stu wants to know, if he gets a genetic test, will insurance use the information against him? So interesting. And could it end up raising his rates or cause him to be denied coverage? That's a great question. Shobana.
Yeah. So there's a federal legislation called Genetic Information Non-Discrimination Act, so GINA, and that prohibits health insurance from using your genetic information to determine your coverage, rates, or any aspect of your health care, whatever they cover. So GINA protects health insurance coverage. GNAD does not apply to life insurance. So if you carry a genetic mutation or variation, as insurance would call it, they can use that information to determine. But I want to also emphasize life insurance is determined by many factors, not just genetics alone. So if you came in for a session, we would always say, talk to a life insurance specialist, because if you are already affected with a condition, so in cardiology, for example, if you already have congenital heart defect, a cardiomyopathy, life insurance may use your clinical diagnosis because you're already expressing symptoms of a disease to determine. So genetics is one component of decision making for life insurance, but definitely health insurance, it does inform. If you have a genetic variation, it actually allows insurance to approve all the other surveillance that needs to go. So for example, in your case, for example, if we knew that a child had a genetic variation and they only at this time have the heart but not the hearing, we would use that information to say, this child has a genetic susceptibility for hearing and needs more frequent hearing evaluations, and this is why it needs to get covered.
Oh, so it can
actually help in
you.
the health insurance aspect, having in cancer, in cardiology.
Right.
That's why we do testing, because it is an added benefit to getting coverage for the surveillance you need to manage the risk.
Okay. Now, Jeremy wants to know, he writes, depending on the genetic misspelling, is there anything you can do to affect the genes or protein production, or is it more about understanding the specific issue that the misspelling will cause and then treating that with more accurate focus? I'll ask.
Yeah, so I don't know about the congenital heart, and that I will punt it over to Dr. Serfas, but definitely other types of cardiac myopathies, arrhythmias, other ones, definitely there are targeted treatments if you know the genetic variation, the gene and the variation that's causing it. So it's not just for knowing, though Addison can speak to how knowing has helped her understand, oh, this explains why I had the challenges. So I don't want to discount that value, but definitely there are medical treatment, very specific ones indicated based on the gene and the variation. But what about for congenital heart?
You know, for most congenital heart defects, once the congenital defect is there, the cat's sort of out of the bag. And so there's not typically a lot that can be done genetically or to modify those proteins after it's happened to fix things. But there are times when an underlying genetic defect will, similar to what you're describing, change the way we manage certain problems. And I think a common example that we run into is there's a lot of genetic causes of dilation of the aorta, which is a big blood vessel that comes off of the top of the heart. And we have certain thresholds that we use. If the aorta gets above X size, that's time to go to surgery to fix it. Well, if you have a known genetic defect that predisposes you to bigger problems, we might fix it earlier, and we have different thresholds for those. So the genetic defect can really impact our management in certain conditions.
Which is so important. We have two comments coming in. Vera McLeod writes, very interesting conversation. Thank you for having it. You're welcome, Vera. Thank you for watching. And Ruth Ellen says, very interesting topic. And this sure is. I want to get to some final thoughts from all of our guests. And Addison, I want to start with you because you've chosen a career in healthcare and now you work with heart patients in cardiac rehab. That must provide so much comfort. What's it like for you to be on both sides?
I love being able to share my story, which was kind of my main goal of kind of coming here and working in cardiac rehab, because I get to see patients, you know, they're in the hospital and then they come to cardiac rehab, and if they're struggling or having a hard time, I can, you know, normally I'll go and share my story and be like, hey, I know it is so hard to go through these things, but here I am. I made it through. I know that you can also make it through. And so just being on both sides is really just, I really have no words to kind of explain it, but it's just so comforting just to be able to kind of share my story, and just, I want everybody to know, like, you're going to be okay one day. It's going to take a really long time to get there, but your story also matters. And so just having somebody, and I think for the patients as well, just knowing that somebody is on the same side as them kind of helps them, motivates them to keep coming to class or to keep working out at home, because they can see, you know, hey, she's doing it, then anybody can really do it. So
when you sharing your story is so great, because there is a kid that's going to see this, maybe a little girl feeling discouraged or sad, and then she's going to see you, and what a comfort, what a great thing that you're using this platform to share that. Shobana, what do you see for the future of genetic testing?
Yeah, so where I see this going is really genetics across the lifespan. So you mentioned kids, Addison mentioned, you know, I'm an adult, I got through this. So that's where I see genetics going, is there are going to be, genetic testing is just really going to become more routine at different stages in your life, across the lifespan, from children to prenatal to adults. There are different genetic tests, and that is where genetic counselors help you understand at what stage which genetic test is going to be helpful to inform your health care. So for taking on to Addison's journey, knowing that there had been hearing loss running in the family, with this information, to get that information early helps through the school years. In hindsight. So that's the parent's choice, right? To determine how much information do I want to know, at what stage in my life am I ready to learn that information. And that's where genetic counselors are, is to help families, providers navigate that journey in helping genetic testing used for health supervision, diagnosis, and really identity and adapting to it.
Dr. Serfas, what do you want our viewers watching to know?
I think I'd like our viewers to understand that the genetic testing is, and counseling, which honestly in my mind is the more important part of the puzzle than the test, is available. And it's not for everyone. It doesn't provide answers for everyone with a heart condition, but it can be really impactful. And so, and can be life-changing, not just for the patient, but also the patient's family, for future family planning. And so definitely worth talking to your doctors if you have concerns.
Yeah, and the counseling part, we haven't touched on that enough. Shobana is so sensitive, and I can tell that you approach this with such a sensitivity. It's not like you take a genetic test in the mail and then you just get this list back and you send them off. You're having really deep, important conversations.
Yeah, and I'm glad you bring that up, because one of the challenges we face in healthcare is both the access to testing and also making sure it's delivered in a culturally, socially appropriate manner.
Right.
And that's the balance that we face every day in clinic, is how do we make it accessible, but how do we also scale up? And that's where, you know, my team of 9 genetic counselors, we're always, thank you for bringing it back, is it's not about the testing, it's also about making sure the result is meaningful to you.
Absolutely. This is an incredibly interesting conversation, and we love sharing the work that our doctors and nurses and our whole care team, the geneticists, do here at the health system. Have you ever wondered what makes them happy outside of work?
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Oh, this
Okay, Shobana.
Oh my God, there's my little doggy.
Full disclosure, you brought your daughter here today who was like, wait a second, you're showing the dog and not me. We'll have you on again. We'll show your daughter. She's lovely.
Yes.
Tell us about your little furry helper here.
Oh my God, that's little Clover. He's beside me all the time, every day. He loves to sit behind my table. He's like a baby.
Do you really take him to the park and put him in the swings?
Yeah, we do.
Often?
My daughter and I do. Yeah, he makes the day go by really well.
So we see your dog, and we raise you another dog, Dr. Serfas.
Oh my gosh!
Okay, Dr. Serfas, you have 3 kids at home, wife, 3 kids. You decided to add a puppy into the mix?
Yeah, well, you forgot the 2 cats.
Oh, and 2 cats. Holy cow.
Yeah, this is Roger. Roger is 3 months old. He's brand new, and he is a terror. I have 3 boys who love playing with him, and it's just such a joy to see them get to play with him, chase him around the yard and such. And he likes to attack one of our cats, and actually, I think he likes it.
The cat?
The cat, yeah. So this morning he dragged a little toy over to Roger to get them to start playing. So, they have a good time.
Oh, that's so sweet. You'll have to keep a tally on how many shoes and things Roger destroys.
I mean, it's already getting up there.
Okay, all right, you had to use your fingers to count.
Right.
Thank you for sharing Roger, and thank you for sharing Chloe.
Clover.
Clover, the little puffball, and Addison, thanks for sharing your journey. Yeah. This is going to help a lot of people. Thanks for joining the conversation with us today. Coming up next week on All Things Heart, hope. That's what Haley Taylor found right here at the University of Kansas Health System after other doctors at other places told her she had no future. Her story is next Thursday at 8 a.m. Coming up on the Morning Medical Update. 3 kids at home, a 4th on the way, but doctors kept seeing something off in Whitney Mayer's blood work. I'm Alexis Del Cid on the next Morning Medical Update, learning you have cancer and even starting chemo while pregnant, how oncologists and obstetricians came together to save mom and baby, Friday at 8 a.m.